Okay, hello. I just wanted to do some vlogging about this because I need to kind of do this for myself to process what's going on at the moment. Been having some severe female issues since December, and to the point of ending up in the emergency room and not knowing what was going to happen with that because it was really bad. And they found a cyst on my uterus, so they sent me to a gynecologist. When I saw the gynecologist, they did a full exam and they did 2 biopsies of my uterus. And on Monday, I went in and found out that there were abnormal cells. They were not cancerous, but can turn into cancer if taken too long. So basically, it's precancerous cells. He said that we couldn't even wait 3 months until the end of the year. He's like, we need to have it done as soon as possible because the risk for it turning is very high. So that was on Monday. Today is Wednesday. They called me Monday afternoon. They told me it was going to take 1 to 2 weeks for my insurance to clear me for surgery. They called me Monday afternoon and said that after the insurance people talked to the doctor, that they cleared me for surgery for this week. So surgery is scheduled for Friday morning. So today I'm in doing all the pre-surgery stuff, doing all the tests, got my orders in, took and had my blood work done, did the 3rd urine test in a week. Not pregnant people, stop it. I get it has to be done, I get it. But had blood tests and stuff done. And went over all the procedures, everything that's going to be done, how I'll have to be here at 8 o'clock in the morning, surgery's at 10, blah, blah, blah. The normal stuff. And then at the very end, they went in to do an EKG. And unfortunately, the EKG came back as abnormal. She did the EKG, and she's like, let me check and make sure that everything's hooked up right. So she double checked everything, and she's like, yeah, it's hooked up right. And then she's like, well, let me redo this again. I was like, is there a problem? And she's like, well, I can't really say. And then she took it again, and she's shaking her head, like, and I'm like, what's wrong? And she goes, well, I can't, no, I was like, you have put me through several surgeries. Just what's wrong? So she's like, there's a problem with your EKG. I'm like, oh, what kind of a problem? She goes, you have an erratic heartbeat. And I'm like, that's weird because I had to go to a Social Security disability medical hearing, or not hearing, evaluation. I said, and they took my heart rate and it was erratic then. And she's like, well, if it was erratic then and it's erratic now, you probably have developed some sort of a heart problem. And I was like, well, I have PAC, which is premature arterial conduction. And she goes, I don't know if that's necessarily it. And I'm like, okay. I was like, well, that's hard to catch on an EKG anyway, because it's very sporadic and very fleeting. It's like, it's done. So I looked on the EKG when I came out to the car, and it says right ventricular hyperopathy, some all prominent are in V1 late transition. I think it's some bunch of other like stuff. So I looked it up to see what it says that is. And according to this, it's a problem with the ventricle and the vein going in, the artery going into my heart. It's like a thickening. So it's not beating properly to push my blood through. which kind of makes sense now why my blood pressure is so high. My blood pressure today was 150 over 89 or 85. So, and it's been high the last 3 times I took it. It's been really high, and it's not, I don't have high blood pressure. So, I'm waiting now to see if the doctor wants me to see somebody, or if they want to like just put me in the hospital a day early for observation beforehand, or what exactly they're going to do. If they're going to reschedule it, if they're going to just stop the surgery until I get cleared, to see what's going on. But this is just one more thing in a long line of problems, and it's getting to the point where it's really bothering me. I know there are some people in my life that are going to be like, I'm blowing this up. I am making this out to be more than what it is. I am, panicking for no reason or whatever. And that's just not the truth. It's not, I'm not panicked. I'm concerned. I'm not blowing it up because I have the frickin' paper right here stating there's a problem. So I'm just having a really hard issue. I'm trying to use these vlogs for working things out in my head and trying to get a way to get things handled and try to understand things a little bit better. So it's really difficult today. This is really hard. Squigs has been glued to me, like sitting on top of my feet. When there's anybody that knows Squigs knows he wants to be like in the middle of the walkway, stretched out, taking up as much room as possible. And he kept tucking up on my feet and laying on top of my feet, which is, when he doesn't have to be tucked, is not normal for him. So I think he was picking up on some of what was going on today. So, but I guess it's a waiting game and to see what's gonna happen at this point. So, yeah, I'm kind of anxious and a bit upset and not sure how to handle everything that's going on. The other thing that the nurse said was a possibility was they may just have me go to the emergency room and be seen. So I don't know what's going on right now. But I don't have much choices in what's going on. I just kind of have to roll with it and see what happens. So that's where we're at right now. So if nothing else, this is for me to be able to process what's going on. Just, it's a lot to deal with. A lot. So, thanks for listening anyway.